Dear students, today we are going to learn on the topic of the tibia bone. Let's begin. Tibia is morphologically a typical long bone, and this bone is developed by intercartilaginous ossification. The tibia has three parts. They are the upper end, the shaft, and the lower end. The upper end has a medial condyle, a lateral condyle, intercondylar area, and tibial tuberosity. In between the medial and lateral condyle, the medial condyle is larger. Now we will learn how the knee joint is formed. Upper part of the lateral condyle of tibia articulates with the lateral condyle of the femur. In this way, knee joint is formed. Another important question you have to know that what is the attachment of the intercondylar area? The attachment of the intercondylar area from anterior to posterior are anterior horn of medial meniscus, anterior cruciate ligament, anterior horn of lateral meniscus, posterior horn of medial meniscus, posterior horn of lateral meniscus, and posterior cruciate ligament. What is meniscus? Meniscus is a fibrocartilage. Some other fibrocartilages are intervertebral disc, glenoid labrum, and acetabular labrum. What is the function of the meniscus? It acts as a cushion. It prevents the friction between two bones. Now, let's come to the medial condyle. The medial condyle has four surfaces. They are anterior surface, posterior surface, medial surface, and superior surface. The superior surface articulates with femur, and the posterior surface presents a groove where semimembranous muscle is inserted. Now, let's come to the lateral condyle. Lateral condyle presents a fibular facet posterolaterally, where it articulates with the upper end of the fibula to form superior tibiofibular joint. This superior tibiofibular joint is a plain type of synovial joint. Above the facet, there is presence of a groove for the insertion of the popliteus muscle. The anterior aspect of the lateral condyle presents another facet. You have to remember that. The attachment over here is iliotibial tract. Now, what is iliotibial tract? The deep fascia of thigh is laterally thickened and it forms a strong fibrous band. This strong fibrous band is called iliotibial tract. So, where is this iliotibial tract attached? It is attached on the tubercle of the iliac crest. On the iliotibial tract, there are insertion of two muscles. They are tensor fascia lata and some flexor of the gluteus maximus muscle. What is the function of the iliotibial tract? The iliotibial tract gives stability to the knee joint. Now, let's see the tibial tuberosity. The upper part is smooth where ligamentum patella is attached, and the ligamentum patella is formed by quadriceps femoris. The lower part is rough, where there is attachment of subcutaneous infrapatellar bursa. Now let's come to the shaft. The shaft presents three borders: anterior border, medial border, and lateral border. The anterior border is sharp, which is also called the sheen. This part is actually subcutaneous. The attachment in this part or the attachment in the anterior border is deep fascia of the leg. The lateral border is also called interosseous border. The attachment on the interosseous border is interosseous membrane, which forms the medial tibiofibular joint, which is a fibrous joint. Now let's come to the shaft. There are three borders and three surfaces present in the shaft. The three borders are anterior border, medial border, and lateral border. The anterior border is sharp, which is also called the sheen. The anterior border or sheen is subcutaneous. Attachment over here is deep fascia of the leg. The lateral border is also known as the interosseous border. The attachment of the interosseous border is interosseous membrane. The interosseous membrane forms medial tibiofibular joint, which is a fibrous type of joint. Now, what are the surfaces? First of all, we will learn about the medial surface. The medial surface is subcutaneous, but the upper end gives insertion to the three following muscles. They are from before backwards, sartorius muscle, gracilis muscle, and semitendinous muscle. Remember, all these three muscles are inserted into the medial surface. These three muscles are together called the gyrops muscle together. Okay, so these three muscles are called gyrops muscle together. Now, there may be a question that why these muscles are called the gyrops muscle. Well, these three muscles are originated from different compartments of the thigh. They are supplied by three nerves, but they are inserted into one region. As they are inserted into this one region, so it is called the gyrops muscle. These three muscles are arranged in a tent shape. The origin of the sartorius muscle is from the anterior compartment, and it is supplied by the femoral nerve. The origin of the gracilis muscle is from medial compartment, and it is supplied by obturator nerve. And the origin of the semitendinous muscle is from posterior compartment. It is supplied by the sciatic nerve. Now let's come to the lateral surface. The upper two-thirds of the lateral surface gives origin to tibialis anterior muscle. Now let's come to the posterior surface. Upper part of the posterior surface presents a line which is called soleal line. On the upper part of the soleal line gives insertion to popliteus muscle. On the soleal line gives insertion to fascia covering the popliteus muscle, fascia covering the soleus muscle, origin of the soleus muscle, and deep transverse fascia. Below the soleal line, there is presence of a vertical ridge which divides the posterior surface into medial and lateral area. On the medial area gives origin to flexor digitorum longus muscle. On the lateral area gives origin to tibialis posterior muscle. Lower part of the posterior surface is related to the following structures. From medial to lateral, they are tendon of the tibialis posterior, the tendon of the flexor digitorum longus, then posterior tibial artery, tibial nerve, and tendon of flexion hallucis longus. Now let's come to the lower end. The lower end has five surfaces. They are, first of all, the anterior surface, then the posterior surface. There is a groove in the posterior surface which contains tendon of the tibialis posterior muscle. Medial surface. There is a projection in the medial surface which is called the malleolus. Tip of the medial malleolus gives attachment to deltoid ligament. Lower part of the medial malleolus gives attachment with the medial part of the talus. Now, lateral surface. Lateral surface presents a notch which is called fibular notch. This fibular notch articulates with the lower end of the fibula to form inferior tibia fibular joint. This is syndesmosis type of synovial joint. In the inferior surface, articulate with the upper part of the talus and form the ankle joint. This is hinge type of synovial joint. The rough part of the fibular notch gives attachment to the interosseous tibiofibular ligament. There is another question that may be asked, that is, what are the subcutaneous part of the tibia? So, the subcutaneous part of the tibia are lateral condyle, medial condyle, anterior border of the shaft, that is also known as shin, then medial surface of the shaft, not the whole of the medial surface, that is except its upper end, then medial malleolus and lower rough part of the tibial tuberosity.